Does Medicaid expansion lower hospital uncompensated care costs? Imagine a hospital in a community where many patients walk in without insurance. They often leave without paying, which adds up to big costs for the hospital. Now, what if more people had health coverage? Would that change things? That's what we're here to find out. Medicaid expansion under the Affordable Care Act, or the Affordable Care Act, was designed to help more low-income adults get health insurance. Before this, many people, especially those who are working poor or nearing retirement, couldn't qualify for Medicaid. When they show up at hospitals without insurance, hospitals often end up covering the costs themselves. These are called uncompensated care costs, and they include free or discounted services for patients who can't pay. When states expanded Medicaid, more low-income adults became eligible for coverage. This meant fewer people were uninsured and needed free care. Hospitals saw a drop in the number of uninsured patients, especially in safety net hospitals that serve many low-income residents. Because more patients had Medicaid, hospitals received payments for their services, which helped balance their budgets. This shift from unpaid bills to Medicaid payments improved hospital finances overall. Hospitals could better cover the costs of emergency care, chronic disease treatment, and routine services. This is especially important for seniors and retirees who are relying on hospitals for ongoing health needs. When hospitals are financially healthier, they are less likely to close or cut services, which keeps health care accessible for older adults. Rural hospitals tend to have higher rates of uncompensated care, but Medicaid expansion has helped lower these costs in rural areas too. This is good news for retirees living outside big cities, where hospital closures are more common. However, if federal funding for Medicaid is reduced or the enhanced federal match is ended, hospitals could face more unpaid bills again, which might threaten access to care. In the end, Medicaid expansion helps hospitals by reducing the unpaid bills they have to absorb. It also supports the healthcare needs of seniors and retirees by keeping hospitals financially stable and able to provide the care they depend on. So, yes, expanding Medicaid does lower hospital uncompensated care costs, making healthcare better for everyone, especially those who need it most.